Now, when we work with back pain, there's a secret, and I'll tell you what the secret is. Back pain has very little to do with the lower back. So it may sound surprising, it may sound shocking, because the pain is in the back, and even if you have an MRI, you may actually have dysfunction or degeneration in the low back, possibly a disc herniation or sciatica. However, the low back is the area of weakness in our body. It's the area where all of the weight of the world falls onto. And so there may be nothing actually wrong with your spine. It's just the other things, the other areas around the spine are not working properly. And so all the weight and the pressure is moving right into the low back. And you may suffer from a herniated disc or from degeneration or osteoporosis or stenosis or sacroiliac joint dysfunction because of excess pressures on the spine. But the cause and the actual source of the problem is not that you have a bad back. Okay? A lot of people say, I have a bad back. You probably were not born with a bad back. You probably came into the world with a perfect spine. It's just the wear and tear of the body and gravity on the spine has taken its course. So what we're going to look at throughout this course and throughout the training are different areas surrounding the spine and surrounding the lower back so that we can take pressure off of the low back. So what am I referring to? Specifically, we want to work on the hip joints. All of the muscles around the hip joints actually act as pulleys, and they restrict movement in the spine because it restricts movement in the pelvis. If you look at many of the muscles, which we'll go into through our anatomy lectures, you'll see that their attachment points begin at the pelvis, and they cross the hip joint and attach into the femur or into the knee. And what they do is they assert a pull onto the pelvis, which creates a certain positioning, which then affects the lumbar spine because the pelvis and the lumbar spine are connected. So any tightness, tension, imbalance, difficulty within the hip region is going to have a direct effect on the lower back. And I've seen this throughout my practice at individuals with either asymmetry or imbalance in their hips, creates pressure on the lower back. And when we work on the hip joints without even touching the lower back, it often improves back pain. So one of the joints that we're going to work on are the hip joints. We're also going to take a look at the sacroiliac joints. This is an area of the spine that is often not discussed, not diagnosed when you go to see a physician, and it's really important. It's an area between the sacrum and the pelvis. Okay, so it's below the low back. It's not actually the lumbar spine, but it's the area below it where the sacrum and the pelvis meet. And these joints can become a problem as well. Sometimes there's too much mobility, which causes pain, and sometimes there's not enough mobility, which can cause restriction and limitation in movement. And sometimes there's actually a twist or a torsion, we call it, where the sacrum is rotated and there's uneven pressures on the surfaces of the sacroiliac joint. And sacroiliac problems can often act like lower back problems, but they're actually not. And we can deal with them through our asana practice and through some of the therapeutic sequences that we're going to go over in this course. And then we're going to also take a look at the upper back. Right? Something we don't think about very often because we can't see it. It's in the back, but it's also behind the heart. And this is the area which tends to get tight and rounded when we're sitting at computers all day or driving. And very often our mind is not in our upper back. And we're going to learn how mobility in the thoracic spine is very, very important to take pressure off of the lumbar spine. So if you don't have any movement in your upper back, then the chances are that most of the pressure, especially during twists in yoga, are going to fall onto the lower back. And what we're getting is an uneven distribution of force. So the upper back or the thoracic spine and lack of mobility there can definitely also affect the lumbar spine. So we're looking at the hips, the sacroiliac joint, the thoracic spine, and of course we will look at the lumbar spine, but it's less about what the MRI shows or what the X-ray shows. that signifies what the outcome will be. What really matters is that there's no compression in the lumbar spine. So what do I mean by that? If you have a disc, let's say you have a disc problem and the disc is pushing on a nerve in the low back, in the lumbar spine. So we see this on an MRI, we clearly know there's a disc bulge or a disc herniation, and there's symptoms that are consistent with sciatica. So we know there's pressure. Now, if we took this MRI and compared it with someone else who didn't have back pain, they might actually have a very similar MRI with a disc bulge and pressure on a nerve, but they may not have pain. So the reason that pain comes when you have pain in the low back, it's not because there's a disc, often, but it's because the disc is compressed, that there's pressure. There's a feeling of pushing of the bone on the bone on the disc on the nerve, different areas that are pressing on each other. And so if we can create space and unweight the low back and take the pressure off the disc, even if the disc is still there and doesn't go anywhere, there will be less pain. So it is possible to have results on your MRI or X-ray that don't look so good, but to actually not have pain or any discomfort because of them, if we maintain space in the spine. And what we're going to do in this course is go through many tools and many techniques that will help you create that space, decompress the spine so you can feel taller and freer and have a happy, pain-free life. This is a lot to do, so it's hard work, but I invite you to join me on this journey. And I'm excited to share all of these tools and techniques that I've learned and I've applied to myself. I healed my own disc herniation using yoga, and I use it every day to help balance my scoliosis, and I know that your students will benefit from it as well.